Hello everyone. So now we'll be discussing about basic epidemiology and population health. We have covered a few topics on COQP22 entrance exam for hospital management for the CUTPG. Let's move forward. If you haven't watched the previous video, please check out the videos given on our channel. So let's start. So what is epidemiology? Epidemiology is the study of how disease affects population, their distribution, causes, and control measures. Population health focuses on improving health outcomes for entire communities through prevention, treatment, and policy making. So, key concepts of epidemiology are let's discuss. First is determinants of health. So, biological, environmental, social, and economical factors influence health, as we have already discussed in so many previous topics. Uh, Epidemiological traits. So, traits already we discussed in previous topics: agent, host, and environment. These are three component of epidemiological trait. Then we have disease occurrence pattern. So, when a disease start, it usually occurs start from a local region, or we can say specific region. So that time we call it endemic. Endemic is what? Disease regularly found in a specific area. Example, malaria in tropical region and all. Then epidemic. Epidemic is what? Which sudden increase in cases in a population. For example, COVID-19 outbreak. It's not COVID-19 entirely globally, it's outbreak only. What called pandemic? Pandemic when it becomes globally, right? Spread globally. So global spread of a disease is called pandemic. That is COVID-19 pandemic. Then we discuss about importance of population health. So reduce health disparities through targeted interventions, improves the healthcare system efficiency by focusing on prevention, guides government policies and health programs. So that's the importance of population health. Now next we discuss rates, ratios, and measures of morbidity and mortality. So we have some formulas over there. You need to learn those formulas. Epidemiologists use statistical tool to measure disease impact and health outcomes, right? So common health indicator are morbidity, mortality, and some other keys. One of first of it is morbidity, that is illness indicator, right? So incidence rate, new cases of a disease in a specific time frame, right? So how do we find incidence rate? New cases, number of cases appear, population at risk, right? So, to population we usually take in thousand, like one cases per thousand people, two cases per thousand people. Okay, then we can find the rate from there. All right, so we have incident rate is new cases by population at risk. It should be risk, right? Risk. Then we have 1000 into 1000. Prevalence rate. So prevalence rate is what? The total number of disease cases, new plus existing at a given time. Prevalence rate is total cases by total population into 1000. Next we have mortality. Mortality is the death indicator, right? So crude that rate, as we already discussed. CDR is total population by total death into 1000. Next we have infant mortality rate. IMR, that is infant death in less than 1 year by total live births, 1000. And then we have maternal mortality rate, MMR. MMR is maternal deaths upon live births into 1000. Then you may say like rate is counted with the into 100. So this is not the percentage, guys. This is the rate. So this is the value it will generate. We call it a dash value per 1,000 person, like that. That's why there is 1,000. Now move forward. Other case ratio is case fatality rate. It is proportion of death among diagnosed cases, right? How many people are dying or dead among diagnosed cases, right? That is case fatality rate. Uh, Dependency ratio measures the proportion of non-working dependent population to working population. So suppose in your family, one is working person and four are dependent on it, right? I mean, dependent on the working person, they are just eating, they are not working. So ratio will be 4:1, right? That is dependency ratio. Next, we have basic statistics of association and causation in biological science. Epidemiology relies on statistical methods to establish relationships between risk factor and diseases. Measure of association, relative risk RR, likelihood of developing a disease in exposed individual compared to non-exposed. RR is equal to incidence in exposed individual upon incidence in non-exposed individual. Odds ratio OR used in case control studies to estimate disease risk. OR is odds of exposure in cases, odds of upon odds of exposure in controls. Next, we have attributable risk. It measures the proportion of disease cases linked to a specific risk factor. Next, we have establishing causation, Broad Hill criteria. Sorry, Bradford Hill criteria. So we call it Bradford Hill criteria. It includes strength of association, consistency, specificity, temporality, biological gradient, plausibility, coherence. So high relative risk suggests a strong relationship, that is strength of association. Repeated studies shows the same association, that is consistency. A single cause lead to a specific disease, that is specificity. The cause must precede the effect, that is temporality. A dose response relationship exists, it means biological gradient. The association aligned with biological knowledge is plausibility. The findings do not contradict existing knowledge, that is coherence. Concept of diseases, transmission, immunity, and immunizing agents. So first is modes of diseases, disease transmission. Direct transmission, person to person contact. Example STDs, respiratory droplets. Another is indirect transmission, that is including through contaminated surface like vomits, food, water. Vector-borne like mosquito-related, malaria, dengue. Airborne transmission like tiny droplets suspended in the air, example tuberculosis. Then we have types of immunity. So one is innate immunity, one is acquired. So innate immunity is what? Natural defense mechanism. So main barrier for this mechanism is skin and mucus. So they defend uh, microbes and a lot of external potent or we can say irritants. Then we have acquired immunity. It is basically of two types, active and passive. Active is the one which you got from vaccines and natural infection, right? Passive is the one which you get from maternal breast milk, right? Maternal antibodies from breast milk. Then we have immunizing agents. So one form of immunizing agent is live attenuated vaccines. So those are weakened form of pathogens. Example MMR, BCG. Next we have inactivated vaccines. It include killed pathogen like polio, hepatitis A. Next we have toxoid vaccines. It also include inactivated but inactivated toxins like tetanus, diphtheria. Then we have mRNA vaccines. Teach cell to produce an immune response. Example COVID-19 vaccines. So you can learn a few more example of those types of vaccines. They may appear in the exam. So here, okay, MMR means measles, millets, and yeah, measles, mumps, and rubella. Yes, measles, mumps, rubella. Okay, so you can also find out more examples. Next, we have basic understanding of disease prevention and control. India follows a structured approach to disease prevention through national programs and policies. Level of disease prevention: primary prevention, secondary prevention, tertiary prevention. Primary prevention include preventing disease before it occurs, vaccination, hygiene, health and education, vector control, early diagnosis and treatment, screening programs, cancer, diabetes. Tertiary include reducing complications, disabilities, rehabilitation services, chronic disease management. So starting from primary to secondary, we have then we have national health program in India. One of them is national immunization program that covers vaccination under universal immunization program UIP. We have a national vector-borne disease control program NVBDCP, malaria, dengue, chikungunya control. Then we have national tuberculosis elimination program NTAP that focuses on TB diagnosis, treatment, and prevention. Then we have National AIDS Control Program NACP for AIDS prevention and management. Then we have Integrated Child Development Services ICDS, Nutritional and Maternal Child Health Services. So this is what we have covered in this topic for today. Next we will cover in the next video. Thank you so much for watching. If you have any query, any doubt, or comment down below. You can download this PDF from the link given in the description. Thank you so much. Good luck for your exam.